Hey guys, I'm Daniel Aragon, and today we are going to talk about health insurance. Specifically, we are going to talk about deductibles. It's a confusing topic, a lot of us don't know about it, but today we will learn about it. So, in general, a deductible is the amount of money that you or I have to pay out of pocket before the health insurance begins to cover the costs of our medical care. This means that if you have a deductible, you will have to pay the certain amount of medical expenses on your own until you reach a limit or a dollar amount, that dollar amount. And then once you reach that dollar amount, then the your health insurance will cover the rest of your expenses is within the time frame of your contract, right? So for example, let's say you have a deductible of $1,000, and you go to a doctor for checkups and you have these procedures or these small procedures in the clinic, and your cost for those small procedures is, let's say, $100. So you have a deductible of $100, and your first procedure, let's say on January 1st, is $100. Then you have to give, or you have to pay out of pocket those $100. Okay, this is separate from the copay. This has nothing to do with the copay. This is just deductible. So you have those $1,000, and then you had this episode that you had to have a procedure, and that procedure cost $100, and you pay out of pocket. So you will continue paying out of pocket until you reach that $1,000. So let's say if now you pay that $100, you had two or three procedures, now you're up to $300. You go to the hospital and you have this surgical emergency, you have appendicitis and they have to get it out, and the surgery, let's say, cost $10,000. So from that hospitalization that cost $10,000, you still have another $700 left to fulfill your deductible. So from that hospitalization, you have to pay $700 out of pocket to get and cover your deductible to reach that $1,000, and then the rest of the $10,000, your health insurance will pay for that. So it's very important to understand your deductible and how it works, because it can honestly have a big impact on the cost of your medical care. So let's say if you have a high deductible, you may end up paying more out of pocket before your insurance starts to cover the cost of your medical care. On the other hand, if you have a low deductible, you may pay less out of pocket, but you may have higher monthly premiums. So think of it this way, it's opposite. So if you pay more per month, then your deductible will be less. If you pay less per month, then your deductible will be much higher. It is also worth noting that some health insurance plans have a separate deductible for certain types of medical care, such as prescription drugs or mental health services. So it's important also to understand the very specifics of your plan and which type of deductibles your health plan has. So what's the process of choosing the right health plan that has the right deductible for you? So there are a couple of factors that you need to consider first, okay? So first is your financial situation. If you have a lot of disposable income, then maybe a high deductible plan will be good for you, because it will have lower monthly premiums. So you will pay less per month, but since you have this high disposable or a lot of disposable income, you can pay for most of the procedures and most of the care that you have. So on the other hand, if you do not have a lot of extra income to pay things out of pocket, then you might benefit from having a low deductible plan, which will be better for you so that you can fulfill and satisfy the deductible sooner, and then for all the care that you have subsequently during the year, that will be covered by your health insurance. It is also important to consider your health needs, right? If you have chronic illnesses or at high risk for certain medical conditions, a low deductible plan may be a good choice for you because it will cover more of your medical expenses up front. On the other hand, if you are generally healthy, you are young, and don't expect to have any medical expenses, a high deductible plan may be a good choice for you because you will have lower monthly premiums. Healthcare deductibles can be a confusing topic, but just think of it as an opposites. The more you pay per month, the lower your deductible, and the less you pay per month, the higher your deductible will be, and less things will be covered by your insurance.